one of the most important things the government can do to help people prepare for and deal with climate emergencies is to partner with organizations that already have networks and then support those organizations in providing information or resources that will help people stay safe and healthy.
Welcome to Flipping the Table. Today, Michael speaks to the diverse team of leaders who work to provide 100,000 Los Angeles County inhabitants with food benefits during the height of the pandemic. The Let's Feed LA County Emergency Food Program was a collaboration between 19 community-based organizations, the county, Public Health Institute, and Wholesome Wave, and was funded with nearly $27 million in CARES Act funding. Its scale and speed provide a model for the types of programs needed in this age of climate chaos.
Hello, this is Michael. Since our founding in 2002, Roots of Change has focused on reshaping the food system to be healthy and resilient. Pandemic was not part of our original plan, but things have changed. Scientists believe that pandemics are increasingly related to destruction of wildlands and the movement of animal-hosted viruses into the human realm. Large disruptions like pandemic or droughts, megafires, and storms will be more frequent and intense as time passes. For this reason, I believe formation and maintenance of nonprofit-based rapid response teams like the one you will hear about today are essential to the public health ecosystem. I'm excited to share a conversation with 4 colleagues with whom I worked on the Let's Feed LA County COVID Relief Emergency Food Program. You might remember that the CARES Act was Congress's $2.2 trillion response in March 2020 to the pandemic. Los Angeles County provided $27.5 million of its CARES Act funding to offer low-income, primarily immigrant families impacted by COVID with millions of dollars in food benefits. Our team delivered that money in only 9 weeks between November 2020 and January 2021. Nearly 100,000 food insecure individuals received aid. This effort succeeded because of cooperation between 24 partnered entities, including a smartphone app called Tangelo. My 4 colleagues and I will describe how we did it. My guests are Annabella Bastida. She is the Director of Membership and Membership Services for the Coalition for Humane Immigrant Rights, or CHIRLA. In this capacity, she provides direct services and opportunities to her members and to the immigrant community at large. Sandy Steigbugel was the Director of Program Operations for Wholesome Wave during our work. She managed the Wholesome Wave team with a focus on nutrition insecurity initiatives throughout the U.S. Amy DeLisio is the Program Director of the Center for Wellness and Nutrition, which is a program of the Public Health Institute. She has over 14 years of experience working on chronic disease prevention through nutrition interventions serving vulnerable populations. And finally, Allison Frazzini is a Sustainability Policy Advisor in the LA County Chief Sustainability Office, where she works to support health equity and food justice. During the first year of the COVID pandemic, Allie served as Deputy Director of the Food Security Branch of the county government's Emergency Response Center. With that, let's hear our conversation recorded not long after we finished the project. Allison, please tell us why the County of LA dedicated funds to this Let's Feed LA County program. What were your goals?
Yeah, thanks so much for that question, and also thanks for inviting me to talk with this wonderful group today. First and foremost, the county wanted to provide support to communities that were going hungry. We looked at who was experiencing deep economic hardship due to the pandemic and who was underserved by existing food assistance programs so that we could try and target limited funds to communities in which they'd have the greatest impact. And the economic data showed that, many service sectors which employ immigrants had been among the hardest hit. And policy and program data showed that many immigrants weren't even eligible for the biggest recovery programs. So it just added up that we needed to target some of our own resources toward immigrant communities. And we knew the importance of having options. Being able to control how you're going to meet your daily needs is crucial to a person's sense of self and self-efficacy, which has very real implications for health besides whatever nutrients you're getting through food. So we wanted to go beyond just handing out groceries and making people take what they can get. We wanted people to have a variety of diverse and culturally relevant options to choose from. Up until recently, I was living in Koreatown, just a few blocks from the apartment that my husband's mother and her family had moved to when they first immigrated to the States from Korea in the 70s. And though the family members are now spread out across the country, those who live within driving distance still make it a priority to come to H Mart and other Korean grocery stores in the neighborhood, because those stores and their food are important to the sense of community, which again also affects our health and well-being. So vouchers to the stores and sellers who provide culturally relevant food seemed like the best type of resource this program could offer. And finally, we knew that people within immigrant communities have good reason often to mistrust the government, and that we couldn't just go door to door to sign people up and, get their information for the program. We really needed organizations who have deep ties and trust within those communities to do the actual outreach and services. So we were really thrilled that Public Health Institute was willing and able to establish this kind of program with all of the administrative complexity that it would entail, and that they were able to partner with groups like Turla, who would make the program impactful.
Wow, that's great. Thanks so much for that very clear statement of what you were trying to do. And we're going to, in the course of this conversation, find out if we actually achieve those goals. So I think I'll go to Amy next. Amy, so share with us, how the program was designed based on what we just heard from Allie, how it was designed, and how the team linked up with the 19 community-based organizations that became the front line of this response to the pandemic.
Yes, thank you, Michael. And I can echo Ellie's sentiments that we partnered with the Los Angeles County to look for those organizations. And here at the Public Health Institute, we developed an invitation to bid. We didn't make it very complex. The funding, we didn't require large budgets and things like that, so it would be easy for people to respond to. It did have a quick turnaround time, so we hosted a invitation to bid and an informational webinar with partners that we coordinated with the Los Angeles County that we knew were trusted members in their community and served the audience we wanted to reach. And we had a quick turnaround time to turn in documents to apply to be part of this program. And we ended up with 19 CBO organizations that actually made this program really successful. They were trusted messengers in their community. They had thoughtful ways to engage their community members, and they spoke the languages of the community members we were trying to reach. So we were able to reach into more communities by this partnership. And we also knew that these were CBOs very busy, and we didn't want to make the process very hard. So we pretty much received 19 applications out of a potential 70. They all turned in what was needed, and they were all able to be part of this program.
Great. Okay. Part of that program was that they received some funding, right, for each of the beneficiaries for the program they signed up. Is that correct?
Absolutely. So we made it a flat fee kind of type of budget. So for every recipient they were able to sign into the program, they received $45. Mm-hmm. And they estimated in their applications about how many participants they could reach. And our goal was to reach around 30,000. And additionally, similar to some of the things Allie said, we designed the program with choice in mind. So we had a variety of options for their community members to receive these benefits. So one was a local Latino chain, one was a more traditional full-service grocery store, and the other was through an app-based program that had 14 preset boxes that were culturally designed for different audiences.
Mm-hmm. That was the Tangelo app. It was Northgate Gonzalez was the one of the retailers, and then Albertsons was the other. Is that correct?
Yes.
Yeah, good. Well, that's helpful to understand that. And I know that another reason that we could successfully do this is that we had partnered with Wholesome Wave, and Sandy is with Wholesome Wave. So, Sandy, it would be really cool to hear from you, because this was really the piece that you were really focused on, was how the Wholesome Wave team and Amy's team from the Center for Wellness and Nutrition worked with both the Tangelo team and the frontline CBOs, the community-based organizations. How did that go down? What were your days like, and how did you make that happen?
There was a tremendous amount of collaboration between the three teams prior to launch, during implementation, and post-registration to handle such a complex program. The collaboration took place daily as we developed jointly training tools, trained the CBOs, and then turned our attention to managing and supporting the registration process with the frontline CBOs. We continually work to improve our model, any new insights shared by our CBO partners in terms of registration efficiencies or challenges that we heard from them. The CBOs were very creative, so they played a very critical role in the success of the program and reaching our program goals. Once registration was completed, our team shifted their focus completely to the participant experience, redeeming their benefits and the ease of that experience for the participant.
So you were on the phone every day with the different CBOs and with the different community-based organizations. You were calling them and eliciting feedback from them. Is that how it worked?
Yes, our team here, along with the wellness team, was split into groups, and we each managed a certain number of CBOs. So we were able to, from the very onset of the program, create a very intimate relationship with the CBOs. So each one of the CBOs knew exactly who their representative was. So if they were having any problems, they could call us directly or text us so that we could give them the aid and assistance and support that they needed.
And then how many days a week were we meeting as the teams to kind of assess what we were doing with the and how it was going with the Tangelo team? It seemed like we were meeting at least twice a week, sometimes every night at the beginning.
Certainly in the beginning and post-registration, when we were at final distributions, we were definitely meeting every day as a larger group. Each one of the Wholesome Wave team members was meeting with their CBOs at least twice weekly to help support them in reaching their goals and to determine if there were any barriers that they were facing that we might be able to help them with. The larger team did meet every single night to go over where we stood with our goals and any new insights that we could share with one another and then share with the CBOs the next day.
Mm-hmm. I remember we were developing a lot of communications that were going out to the different community-based organizations. We were sending them emails with updates and fixes for challenges. It was quite a process. So that actually brings us to Annabella, who is from Churla. You signed up more folks than anyone, perhaps, for this program, if I remember. So, Annabella, can you tell us what it was like for you as being on the front lines of this project? How did you reach the folks that you wanted to serve? What was your process?
Hi, Michael. Thank you so much for the invitation. It's really a pleasure to share this space with you and with my colleagues, who I am so grateful for the amazing support that they provide us. So I just wanted to start by saying that some of the strategies that we utilize is that we contacted a member list of immigrant families, students, and workers to provide information about the program, and we registered their households over the phone. We also, Chile also has a hotline, and this hotline is for the public where community members could ask for information or assistance. And through this means, we inform about the program, and we were able to register low-income immigrant families to receive this critical assistance. For instance, if they were registered for the app application, we guide them through the entire process. For those that are trying to receive their grocery vouchers in person, we organize distribution clinics. We use all approved COVID-19 regulations for that time, so our community members can feel comfortable to come to our place and pick up their cards. And just wanted to share, every distribution clinic, we have an average of 100 to 100 people through the day. We do some kind of a shift through the day, so to ensure that all people were at the same time. And I can say that this was a very, very effective process for us. However, I also wanted to share that during one of the last distribution clinics, by word of mouth, people learn about it, about the program. And one day when I arrived to the building very early, probably like at 7:30, to coordinate the distribution effort for that day, I was very surprised to see that hundreds of people were waiting outside to get assistance. And for me, it was heartbroken to see older women, entire families, pregnant women asking for to receive help. And at that moment, I was so concerned, and I spoke with all my heart to all of them that were waiting. And I explained that we couldn't provide them with vouchers at this moment because we didn't have any. And it was, as I said, hundreds of people that was asking whether we can support even with a car, with $100 or with something. And at that moment, I just asked them whether they could leave their names and phone numbers to see if we can help in the near future. And what I can say is that I feel so grateful that after communicated to our partners, to Public Institute, and we were able to arrange, and most of those people that provide us with information, we were able to provide with the application, and many of these families were able to receive their support. But even until this day, I remember that when that happened, I couldn't sleep just to see their eyes of people that were asking for help, and to see how they really need the support is also that I still have on my mind, and that really impacts me. And that's why I am still coordinating and working very hard to provide with other opportunities for our community members, because I know, as it was previously described, many of our families were the ones that really were affected for this pandemic, and the support, or the general support that has been provided through the county and through the other means has been something that we really appreciate, and I understand that our community is also grateful for, and just wanted to share with you this.
And how many families did you actually reach, Annabella?
Well, we were supposed to support over 2,200 families, and we ended helping over 700 families.
2,700 families?
Yes.
2,700, wow. Sandy, it sounds like Churla and Annabella were at least one great example of one of the community-based organizations that felt like it was working well. What about you? Were you happy with the results? And if so, why? If not, why not?
Absolutely thrilled with the results. We had very lofty goals when we were rolling out the program in early November, with registrations and distributions complete by the end of January. We successfully partnered with 19 CBOs. We served over 29,000 families with $21 million in food benefits when the need was so great. So yes, I'm really happy with the results. In addition, we heard from so many families about how much this program changed their outlook and their ability to put food on their table at such a critical time of year. There was a mom that I had a personal conversation with. She was part of the student group, and she was a single mom, and she was supporting her 3 children while in school trying to better herself. And the food benefit that she was receiving from the program was actually allowing her to shift her budget, pay her rent, and actually buy some holiday gifts for her children that she would not have been able to do without the program. So that was quite a conversation that, I had the honor of having. So the answer is yes, 100%.
We hope you're enjoying the conversation. If you are, please rate our podcast and offer a review. Your voice will help us grow our listener base, which helps us sustain the funding to share these conversations with the people and organizations shaping a more just and regenerative future. A future in which the food and farm businesses are helping to solve the largest challenges of our time.
Amy, why don't you jump in here and before talking about your sense of how successful this was or was not, give us some more details on the benefit size and how people actually had to qualify for the program and what we required for them to qualify for the program.
Sure. So some background on the program enrollment criteria was residents had to be low income, so be below a federal poverty level of 185%. They had to be impacted in some way by COVID, and they also had to have proof that they were an LA County resident. And the enrollment period lasted for 9 weeks, and the food benefits ranged from $600 for the smaller families, so that was people living with 1 to 3 in their household, and $900 for larger families that had 4 or more people living in their household. And when they were enrolled by the CBO partners, they were able to pick from one of the 3 food benefits at the time of enrollment. So they could select home delivery, which gave them access to 14 preset food boxes via the Tandelo app on their phone. They could select in-store shopping at Northgate Market that provided $100 vouchers for in-store shopping, or they could select the Albertsons Vons Heart Card that was able to be used at any Albertsons or Vons store throughout Los Angeles County.
Mm-hmm. There was almost 30,000 families reached, almost $22 million went to those families in the form of vouchers or Tangelo app, which was an electronic payment system. And then the community-based organizations received over $1.8 million in total, correct, for signing up people?
Yeah, we were able to infuse those dollars into the CBOs during the height of the pandemic when they needed it most. We were able to provide some PPE, and they had some of their own. And they were able to support staff development and local employment, as well as reach the most vulnerable populations in those populations' preferred language throughout the Los Angeles County during this incredible program.
Yeah, and we know that I remember hearing stories that there were actually members, that is, employees or volunteers that worked with the community-based organizations who were coming down with COVID. And so people were really, it was during the height of the pandemic, I remember. Allison, so you've heard these different assessments from our colleagues here. I mean, as the county, how did you feel about the program? Did it reach those goals that you mentioned at the beginning? And just talk about the context, because I remember having conversations with you and your colleagues about how, what a difficult time it was in Los Angeles right then, November, December, and January.
Oh yeah, I mean that was definitely one of the waves. I can't remember which one at this point, but where we were just, our hospitals were overwhelmed. There was such a high rate of infection that having the delivery option was really valuable at that time. As to the impact of the program, I mean, I'm still amazed by how far above and beyond you all have gone. And thanks so much to Annabella and Sandy for sharing what you saw and heard community members experience. I think Amy mentioned that, the program ultimately, we were trying to reach up to 30,000 households. And I think we figured out at one point that given how many people are in different households, we helped more than 90,000 people that were able to, get a couple months worth of food through this program. And that was really a lifeline during the pandemic, especially at the height when, it wasn't, things weren't that safe. I think we learned a lot along the way we iterated and made improvements, and we had a second shot. There are, definitely additional options we would want to try and offer with more time and foresight. I would say that the biggest way in which to improve this type of program is to make it sustainable. Access to long-term assistance in the form of cash or cash equivalents can actually lift people and families out of poverty and create more opportunity for them to advance and thrive. We don't really have the resources for that at the county, but we strongly support proposals for the state to do it.
Yeah, and I think it's important to note here again that this program was possible because of the CARES Act fund that came from the federal government, correct? Do you want to talk a little bit about that?
Sure, yeah. The county got a large chunk of funding from the federal government for CARES, and it took a little while for our county budget folks to understand, what they would be allowed to use it for and figure out how to sort of allocate it across a variety of different programs that were helping address the emergency. But we were, so grateful that the budget folks and the board ultimately, really supported this program aimed at, helping people put food on the table.
Yes, I remember when we first began the process of trying to figure out what was allowable and what we could do with the funding and what was required in terms of providing the funding, how people had to confirm that they were eligible. That was a lot of work. I mean, we had to deliver everything between originally December 30th was the deadline, and then when the CARES Act was extended, we got to continue working through January, I remember. But
thank goodness.
It was so fast. Everything had to be done, and one of the advantages was with the app is that we were able to look on a daily basis at how much money was going out the door through the app. And actually through also the cards that were being distributed, the gift cards that were being distributed that were redeemable only for food products at the two different retailers, we were able to track and to see when, it was interesting to note, on Sundays and Mondays it would drop because the community-based organizations were often not able to distribute on those days. But then towards the midweek, late week, it would ramp up, and Fridays and Saturdays, a bunch of money would be distributed to folks, and then it would go. It was really interesting. It was like watching a heartbeat, going up and down, up and down. Yeah. I remember that. So I want to turn back to Annabella. As you think about this, Annabella, if you were to do this again and to design a program, you heard Allie talking a little bit about how she might like to have more time to plan and more options, things like that. What do you think about when you think about how, if you were to do this again, how you would do it, how you might change it, how you might improve it or alter it?
One of the things that I really enjoy the most is the opportunity to work with all my colleagues. For me, working with Tangelo, they were always very polite, really helping us to troubleshooting some of the issues that arise at the time, and also working with our partners with Public Health Institute. It was a joy working with all of them. And as they shared, this was a process of learning. Through the process, it was some challenges, some issues, but in general, I can say that it was a really great experience. And I think that without any doubt, the app and the system help us a lot to implement the program, particularly to have all the information together. Doing the application, the verification of the application was very, very helpful for us. And I love the idea to have food delivery, particularly because of the time where we were in that particular situation. However, if you would ask to our participants, you will see that the majority of them will tell you that they would prefer to get the physical cards and doing their purchases by themselves instead of being waiting for their orders to arrive and being able to get the food that they really like. Even though that we probably were one of the organizations that signed most of the people through the app, that's some of the considerations and some of the remarks that I get from many of those that responded. And also another thing, I know that we have some variety of stores, but I would like to see that we add even more stores so people can select and purchase the food at different stores. Particularly, we encounter some challenges, some people that they didn't have, for instance, people that live in San Fernando Valley, sometimes for them were complicated to come and get purchasing an order, even though that we have the opportunity for Albertsons, we didn't receive enough cards. So I think that on my end, I think that the variety of different options, more stores to sign into the program, that will be really advancing for any future program in the future. But what I can say is that it was a wonderful experience, and all our partners were so supportive and always trying to look for solutions to the problems that we encountered through the process.
It's a complex problem right in the middle of a pandemic.
Mm-hmm.
This was all before vaccines,
mm-hmm.
and people were getting sick in huge numbers, particularly in Los Angeles County. At one point, it was one of the most difficult places in the country in terms of exposures and people coming down with it. And so it was really important that those who were most vulnerable, let's say they had comorbidities and couldn't leave the house, that there was delivery option. But I hear you, and I know one of the things that I've really appreciated about Wholesome Wave through the years is their commitment to the dignity of choice, allowing people to choose what they would like to eat. That's just, it's honoring people and providing an opportunity for them to, make their own choices about how they would like to eat. So it is a balancing act. And
mm-hmm.
and one of the things that I know we've talked about for the future is making it possible through the app for people to choose anything they want, not just a box that's been tailored to different tastes, but to actually let people choose what they want through an app and have it delivered from, many multiple more stores, because I think that is important too. One of the challenges I remember, and Amy can talk to this, is we had so little time to find retail partners just a few weeks, and that was very difficult to do because they had to have the technologies and the gift cards that were limited. You want to talk a little bit about that, Amy?
Yeah, sure, Michael. So one of the criteria was that these stores had to have enough sites across the county, as well as be able to limit purchases to food only, or minimally not be able to purchase tobacco, alcohol, firearms, or lottery with the tickets. And it was just tricky that most stores didn't have those options available. North State was able to develop those food vouchers specifically for this program. And we just kind of got lucky that Albertsons Inc. had recently developed the heart card, we were able to utilize it for this program because it was limiting non-allowable items. And just to speak a little bit about the success of the program, I'd like to just touch on some of the data we collected, if that's okay, Michael, and just the results we saw. Yeah, so we did collect some of those data to realize that about 80% of our participants had lost their job or were working reduced hours due to COVID. And also a quarter of them had to stay home with their school children to help them with that. So they were being impacted and obviously having to feed more mouths during the day because kids weren't in school. So we were able to conduct a small study during the time, and we had about 500 participants complete pre and post test surveys and found that overall we saw a reduction in about 15% of food insecurity related to this program after they received the food vouchers. And we broke that down a little bit further to analyze household size. And it was really encouraging to see that 38% of the larger families, households with 4 to 8, most likely having more children in the home, reported reduction in food insecurity. So we do know that providing people with these food vouchers in this critical time really did help them make ends meet and feed their families.
Wow, that's really interesting. I'm really happy that we were able to get some data that clarified there was true impact. Sandy, so if you were to do this again, how do you think the program could be enhanced?
I definitely hear some themes coming from both Allison and Annabella. As I mentioned, we were really fast to launch this program. So the program implementation model can definitely be enhanced with more upfront planning and integrating our CBO partners into the planning phase of the process to better understand the preferences of the customers that they serve and that we will be serving. I believe that with pre-testing our registration and the training tools, determining the most effective incentive options, and understanding the client base at the CBOs, all in advance of the program launch, will greatly improve the effectiveness of the program and also the participant experience of the program.
Can any of you describe kind of the most compelling or heart-filling memory of the event, of the time that we all spent working together on this? Amy, do you want to start? I know this is a trick question because I didn't send this to you guys to prepare, but it just occurred to me it'd be interesting to hear.
Yeah, sure. I think we're all, as mentioned, all of us CBOs, Wholesome Wave, my team, you. We were working very long hours during a short period of time to see this, but when we were receiving messages from families and the CBO partners about how we were helping people during this time, some people didn't know where their next meal was coming from and how grateful they were and how they were able to provide holiday meals for their families now. It was really heartwarming, and I think it kept everyone going. It was such a crisis across the country, but LA was experiencing huge impacts of COVID, and to help families that really didn't have other places to turn and provide these critical resources during this time, I think was, made me feel so proud about this program and all of our partners and all of the on-the-ground work that was happening to make this possible for these families.
Mm-hmm. How about you, Sandy?
Sure, Michael. There's one CBO partner that I had the pleasure of working with very closely throughout the entire program. And at one point, they sent me pictures of the way that they had been registering their participants because they unfortunately were no longer able to have their facility open. So they were actually, each of them at their own homes, FaceTiming their customers and registering them right there on the computer, on their computer that they were using from home for the program. And that just really illustrated the dedication of the community partners, their creativity and their desire to help their customers at a time where the barriers were incredibly challenging. And it was almost as if they decided that those barriers weren't going to exist because they had such a great opportunity to offer this program, and they were going to find any way that they could to make sure that their customers could benefit from it. So that was incredibly touching. And this was a CBO partner that I spoke to almost daily because of all the barriers they were facing.
Was that Cielo by any chance?
Yes,
yeah.
It was.
Yeah.
Yes, it was.
I do
my
remember.
Favorite.
Yeah, I do remember seeing video of that, of them, folks working from their homes. That was amazing. So, Annabella, you mentioned what it was like that day you came to work and saw hundreds of people in line and the pain that you felt not being able to give everyone some vouchers or some support. But what other memory do you have from that time?
This program impacted me a lot, and I have many memories. I learned about a woman that I knew that her and her husband, they were infected by COVID, and that they were really struggling to put food on the table. And when I learned that, I myself called the person to let her know that she may qualify for this program. And when I called her, and she provided me with the information, and the following day I called her to ask for to mention about the distribution clinic and all the plans that we were doing. And when she mentioned to me that her husband just passed away in her home, and when she was crying, she shared with me all the struggles that she was facing. It was something that it was really touching for me. So what I did is that I took the cards and I leave them on the buzón or the mailbox. I call her and I say that the card will be there. And she just then called me and appreciated it. But it's something that I still have on my mind to see how this program was indeed helping those people that were struggling with COVID, and those people that really need the support is something that I still have on my mind, and something that I really, really appreciate the county that allow us with this funding and having not just the numbers, but the real stories of people that in this particular time, they really need the support, and having someone that not just provide with the cards, but having someone that was able to listen to them and to provide them with the faith that there were people that were caring about them is something that I really appreciate.
Yeah, that's a touching story. I mean, so many people did pass away, and the fact that you were in touch with this woman whose husband died, that is powerful. And, kudos to you, props to you. Thank you for, going the extra mile to drop those off for her at her mailbox. That's a fantastic story. Much appreciated, and I can feel it in my heart. So, Allie, you're a cleanup batter here. What's your memory? And then I'm going to throw you another final question that kind of sets context for really all of us to think about for the future. But do you have a specific memory from that time?
Oh, gosh. When we heard from a participant who said he had like 14 people in his family that were being supported with this program, obviously the amount of food they could get through it, would be spread a little more thin among 14 people. But that also just, to me, really emphasized how much need exists, even just within one household. That was so powerful. So I really appreciated hearing the stories from Annabella and Sandy and others.
Yes. I'm going to give you this last question, which, it's the thing that I think about a lot. I'm thinking about the future of the state of California. As I said at the top of the show, LA County is, if you go by population and budget, is the 14th largest state in the union, and it's a powerful place. And it's kind of a weather vane for the future. And given the climate chaos we're experiencing, the fires, the drought that we're in the middle of now, the fact that they're predicting more of that and epidemics in the future, how are governments going to deal with this? So I'm thinking about that all the time. And do you think this type of collaborative network development, these ecosystems of organizations are going to be needed to be kept together and kind of primed for rapid response in the future for these kinds of disruptions? What are your thoughts about that? I mean, you're the sustainability person for the County of Los Angeles. What are you thinking?
Yeah, oh my gosh. You're absolutely right. And I'm so glad you mentioned climate change related emergencies, because that is another topic that my office works deeply on. We can fully expect disasters like wildfires and extreme heat to keep getting worse in the coming years and decades. These disasters affect people economically. They can, reduce or harm agricultural production, either here in the county or other places we get our food from. And they also obviously put direct stress on people's bodies, your respiratory and cardiovascular system, and increased risk of things like heart attacks. And study has shown that disasters like these actually increase inequality and health disparities over time because of how they affect low-income people and communities of color more acutely than communities that have ample resources to adapt. So we really need to take dramatic action to mitigate and prepare for these types of emergencies if we want to prevent them from disproportionately burdening people who already bear the brunt of many of our societal challenges. My office has made a specific effort to understand how workers are affected by climate emergencies, including immigrant workers whose jobs are not typically classified as dangerous or highly exposed. We partnered with IDEPSA, that stands for Instituto de Educación del Sur de California, to interview several worker groups. And we found out that one of the most important things the government can do to help people prepare for and deal with climate emergencies is to partner with organizations that already have networks reaching people at risk, and then support those organizations in providing information or resources that will help people stay safe and healthy. And of course, a food voucher is just one example of the type of resource that could be valuable. So, I'm a true believer in the idea that community services and networks are a crucial part of any community's and even the nation's infrastructure. Before I started working in government, I worked in community services, supportive housing, some food justice and urban agriculture projects. And I know personally that the outreach workers, the case managers, the volunteers are all essential to the social safety net that helps people stay healthy in the face of loss and economic hardship. And we have to extend that social safety net to immigrant workers who, are the backbone of large parts of our economy, and their families are the future of our society. And we need to embed climate preparedness information and resources into those programs and networks.
Well, thank you, Ali, for summing it up like that, because I am with you. I think all of us on this call are with you that we need to do more to support the ecosystem of organizations out there that are really in touch with the folks who are on the front line in this country. And as you said, are the backbone of so many pieces of our economy and our future culture in this country. So I just want to say thank you to each of you, Annabella, Sandy, Amy, and Ali. Thanks for your time. Thanks for the great work. It was so much fun doing this with you. We worked our butts off, but it was well worth it, and really look forward to staying in contact and supporting one another in the years ahead. So thanks.
Thank you.
Thank you for listening, and thank you to our sponsors, the Ladybug Foundation, Dan and Quincy Imhoff, Beth and Mark Wyatt, Cindy Daniel, and Doug Lipton. Roots of Change is a program of the Public Health Institute.